Hello, my name's Rebecca Evans. I'm from Living Sport, the active partnership for Cambridge and Peterborough. We work with partners to improve the health, happiness and well-being of people across Cambridge and Peterborough. I'm going to talk to you today about what we are now calling the Disability Active Lifestyle Framework for Cambridgeshire and Peterborough. This has been in development for 2 years, and this is now your chance to have a say on the draft version before we officially launch later in the year. So, what are we going to cover today? We're going to look at the why, the who, and the how, the framework itself, our theory of change, working together to achieve our vision, and how to get involved. There is more details on what I'm presenting today that I will share with this recording. So, why? The aim of this framework is to improve the way we all work together to ensure opportunities to be physically active are equitable and inclusive. It is time to make real change for disabled people to access physical activity, leisure in a way they want and when they want, with no barriers placed on them by society. This framework sets out to include anyone of any age who has an impairment of any kind, which means that they could identify as a disabled person by facing barriers to participate, volunteer or work in sport, physical activity or the leisure sector. Disabled people make up 15% of the population of Cambridgeshire and 17% of the population in Peterborough. This equates to nearly 126,000 people in the county that have identified themselves as disabled from the census in 2011. We will obviously be updating this data when we have it from the census in 2021. We know that we know that disability increases with age, as shown in the bar chart on the left. It shows the number of people in Cambridgeshire and the age where they identify as being disabled. We can see here that in the county, 3.5% of the population have a disability, are between 0 and 15 years of age, just under 4,000 people. Whereas by age 50 to 64 bracket, it rises to 18% of the population who have a disability, or around 20,400 people. Just over 10% of the disabled people in Cambridgeshire are of working age of 16 to 64 years old, or just over 40,000 of 95,000 disabled people in Cambridgeshire. So that doesn't include Peterborough. Only 43% of disabled people are active in Cambridgeshire and Peterborough, compared to 66% of non-disabled people. This is according to the recent Active Lifestyle Survey. We are 2% lower than England for active disabled people in this county. Active people do more than 150 minutes of moderate intensity activity per week. The 43% figure drops to 35% if someone has 3 or more impairments. Therefore, 42% of disabled people are inactive, meaning they do less than 30 minutes of physical activity per week. This rises to 48% if people have 3 or more impairments. Physical inactivity is associated with 1 in 6 deaths in the UK. It is estimated to cost the UK economy £7.4 billion annually, including £0.9 billion to the NHS alone. In Cambridge and Peterborough, there are also 2,760 schools-related emergency admissions in 2021 and 2022. at an estimated cost of nearly 12.4 million for hospital treatment alone. This does not include the wider costs of the health and social care system. Many people don't realise that physical activity has significant benefits to health, both physical and mental, and can help prevent and manage over 20 chronic conditions and diseases, including some cancers, heart disease, type 2 diabetes, and depression. Let's get moving. Cambridgeshire was a public health commission programme across all 5 districts of Cambridgeshire running from 2017 to 2020. The work was centrally managed by Living Sport, supporting 5 district coordinators in each of the district councils. Over 4 years, the programme developed 188 new programmes, of which 40% were sustained. They supported nearly 6,800 participants, of which 12%, or just over 800 people, defined themselves as being disabled or having a long-term condition. The project helped 20% of those that defined themselves as inactive to become active. Over 50% of the participants that were not achieving the CMO guidelines at the start of when they were followed up. This all led to a predicted cost saving of 1.5 million on the NHS locally, and could have possibly avoided 343 long-term conditions, including type 2 diabetes, cardiovascular disease, and dementia. This programme has now developed into Healthy You and covers Peterborough as well. It's a great example of how working together across the county to support people's health and well-being through being active can make a difference to people in systems locally. So continuing with the why, we know that disabled people want to be more active, but they don't know the opportunities that are available. Nationally, the statistics from the Activity Alliance annual survey shows 10.3% more disabled people were inactive during the pandemic. Only 30% of disabled people feel encouraged to return to activity since the pandemic. But we know 80% of disabled people want to be more active. We also know from the Active Life survey from local data that 52% of disabled people in the county agree or strongly agree that they enjoy physical activity. They also, 53% also say they have the capability, but only 50% they say they have the opportunity to be physically active. These statistics are backed up by the engagement work we've done over the last year, where we'll be going into a bit more detail later on. As a network, we've been working in partnership for over 16 years to support and develop physical activity opportunities for disabled people, but we know there is so much more to be done. So, who are we? The development of this framework has been driven by a working group with representatives from Living Sport, Headway, Sense, Disability Peterborough, Cambridgeshire FA, and individuals with experience in developing physical activity for the disability community and disabled themselves. The Ability Plus group, or our network, means we are part of a collective of nearly 200 organisations. As I said, Living Sport are the active partnership, and we have been leading the collaboration to develop this framework. We are a systems partner of Sport England. We deliver or support Sport England's uniting the movement strategy locally, which aims to address inequalities for disabled people to participate in physical activity. Sport England's ambitions up to 2025 include more investment and resources for communities with the greatest need, inclusive, safe and accessible experiences as standard, a diverse network of leaders, volunteers and professionals, and collaborating with health, education and transport sectors. Living Sport also work closely with the Activity Alliance, who are the national charity and leading voice for disabled people in sport and activity. They're supporting this framework as it aligns to their Achieving Fairness strategy, focusing on two goals of changing attitudes towards disabled people in sport and physical activity and embedding inclusive practice into organisations. We want to use this platform to do even more work together to make a difference to disabled people. In the development of this framework, we've listened to disabled people and collaborated in the network, hearing from disabled people and professionals locally from a variety of backgrounds and experiences. In the last year or so, I have been to a lot of groups as well as speaking to individuals. Here is just a small flavour of some of what disabled people have said is stopping them from being active. The pandemic was mentioned, the lack of hydrotherapy provision, the fact that people need support to go to activities or get started, that they don't know that opportunity exists and they want to find things to do. They want school holiday activities. Transport is an issue. Planning is needed. They don't have access to suitable activities. Cost is a barrier, particularly when adding transport and other costs on top of session costs. They've had bad experiences in the past and are worried about that happening again. And also simple things like having accessible footpaths so that people can use the local environment to exercise like others can. We want to shine a light on the social model of disability and ensure that disabled people are no longer left behind in our county to battle with systems and deep-rooted, long-standing barriers. The picture represents the difference between equality, equity and justice. The social model of disability helps us recognise barriers that make life harder for disabled people. These barriers are identified as being physical environment, people's attitudes, and the way people communicate how things are run, and how society discriminates against those who are perceived as different. Removing these barriers starts to create equity, where everyone gets the support they need to access the same. Justice would mean that all inequalities are removed. Therefore, disabled people can have more independence, choice and control. We also want to embed the Activity Alliance's Talk to Me 10 principles listed here on the right-hand side. These are there to support providers to deliver more appealing opportunities. There is a short video on the link that we would go into, but to save time, you can go into it in your own time. But I just wanted to pick out a few examples. So the first one, my channels. The use communication channels I trust. The Activity Alliance survey showed that improving or maintaining health is the top motivation for 67% of disabled people. And disabled people often listen to health professionals. My values, number 4. Everyone has values and these are different for everyone and can change over time. But ask what a person wants to get out of physical activity. Is it to improve their health or have fun or make friends? Meeting people's values will motivate them to attend activities and keep coming back. Therefore, we need to work on increasing the variety of opportunities to suit lots of people's varying values and keep people interested in activity. Welcome me, number 9. This came out in the engagement sessions that once someone has had a bad experience, it's very difficult for them to come back and engage again. Therefore, what steps could we all take to make sure people have a good experience again and again? So this slide shows the journey we've been on for the last 2 years. So we started the concept back in January 2021 of maybe having a strategy. We'd done some initial scoping, and that led us to forming a working group by April, which met again for the first time in July 2021. By the end of 2021 and into 2022, we'd run 10 different engagement sessions with a mix of professionals, experts by lived experience. And we had one of our first successes in September 2022, where the strategy that we were developing was referenced in the Cambridgeshire and Peterborough falls prevention strategy. By the end of 2022, so we'd had 10 working group meetings across the 18 months, and we'd spoken to over 200 people and through the groups, and over 40 individuals engaged in one-to-one meetings. This has led us to this point today, which we're launching the consultation of the draft framework. We will then, by the middle of February, have closed the survey, which we'll get a link to at the end of this session. And we will start to develop the plans, the initial work and funding across partners to make this a reality. So some of you will recognise this diagram. We started here with the ideas of the theme of the environments, the workforce, and different people's roles and attitudes to empower disabled people. We've developed that into theory of change. The theory of change, or the framework, looks like this diagram now. So the problem that I've explained in the why is disabled people remain the least active in the county. The pandemic has had disproportionately negative impact on the activity levels of disabled people, and deep-rooted, long-standing barriers are still faced by disabled people wanting to be active. So we had the vision of all disabled people enjoy the benefits of an active lifestyle without barriers placed on them by society. This speaks to the social model of disability, and we hope it is visionary to help us work together to be part of a system to make the change. This leads on to the ambition that there is a coordinated whole system approach to creating the conditions to empower disabled people to have the choices to live healthy, happy, independent, active lifestyles in Cambridge and Peterborough. To do this, we've developed 5 conditions or long-term goals to get us towards the ambition. These are divided into place and people. The place being the access, the physical environment, and access to opportunities in a place or active environment. People being the attitudes towards disabled people and activity, and reframing this to be one of empowerment and choice. Working from the left to the right, the first place one, places where people can be active or welcoming, accessible and affordable. Places that meet the needs of disabled people and their communities. For example, here you'll see in the document that will be circulated with the detail is Neam Park Trust and the 10-year journey they've been on through having an access audit 10 years ago and still working towards some of those outcomes now. And it's a continual process of ensuring they're welcoming and accessible to the whole community. We're already working at Living Sport with a number of leisure centres around the support tools needed and the information, advice and guidance that they need to make their places more welcoming, accessible, and include disabled people, many of whom are already doing a good job but want to do more and have been honest in the support they need. We want to design an inclusive environment matrix support model where this embeds the Activity Alliance Talk to Me 10 principles and the social model of disability, and includes the information, advice and guidance that is needed by places or active environments to help them be welcoming, accessible and affordable and meet the needs of disabled people. Leading on from this into place 2, the second condition is there is an excellent variety of opportunities available that are well promoted, reflecting the range of disabled people's needs and activity levels and values. This links to the first one, but includes a programming element of access and inclusion. We would love to talk about how we can streamline promotion of activities and make sure the right channels have access to the right information. There is already so much happening out there, so many places to find information, but people still aren't finding the opportunities that exist that are right for them in the places they are looking. Therefore, we need to work better together to improve the variety of opportunities, but make sure the promotion of the activities is through the right channels and easy, accessible information is available. Moving on to the middle box and people, the workforce has the confidence and competence to engage disabled people to be physically active and be represented as part of the active workforce. This is the workforce training and development strand, which hope will be key to pulling everything together. Again, we've already have some great examples of training to help coaches and the wider workforce by Activity Alliance, UK Coaching and NGBs, for example. And more of this information can be found in the document that will be alongside this presentation. But we need more at the right time, place, formats and level to enable continued professional development to have better skilled workforce throughout all roles to be confident and competent when working with disabled people. This is also importantly includes representation of disabled people in the workforce, whether that be as an employee or volunteer. There's some great resources out there and also still being developed employers in the leisure sector employ disabled people. We would like to embed great toolkits and resources into how we can all work to support people to do a great job. The fourth box continues this element. Disabled people are informed, empowered by those around them to make healthy, active and independent lifestyle choices. We want to embed this vision, ambition and conditions of this framework throughout the county across all areas, including health and social care and education, so that everyone has a part to play to make sure disabled people and physical activity are seen in a positive frame, and that physical activity can contribute to health and active lifestyles. Again, there are pockets of great work happening, and I've seen many examples firsthand, most recently through the Tackling Inequalities and Together Fund projects that we've helped support. From people in this network like Disability Peterborough, Headway Cambridgeshire, Campsite, Rowan and Facet, to name a few. Only on Monday, I was at Reds Green at their project utilising space at Cherry Hinton Village Leisure Centre to support their service users to get active and support their physical well-being and to improve their mental health. We would like to work with partners across the system and support others to make these great examples the norm for every disabled person who needs support to be active. Finally, the fifth condition, we work as cross-sector partners will come together to understand issues and challenges affecting disabled people, ensuring disabled people are at the core of the co-producing solutions and expanding our collective reach and influence. Building on all the conditions, we want to grow our reach and influence and embed accessibility and inclusive physical activity throughout the county, through which we all can do this more, including more disabled people. Moving Sport see our role as a systems partner proactively leading the ambition of the framework. We will need to leverage financial investment as well as commitment of intent in order to make change at scale. We will drive forward to achieve the vision outlined in the framework, but we cannot do this alone. Having a whole systems approach to the only way we can achieve this condition. So, how can you get involved? We need your help to determine how we make this work. There will be a survey to complete, which is linked in this presentation, but will also be available for people to access. The deadline for this will be the 10th of February. But if something has resonated with your organisation and you have heard today, or you see the opportunity to get involved, please don't hesitate to email me and have a conversation. That's the end of my presentation.